afternoon, and thank you for the opportunity to talk. And it was really good to listen to Professor Burton and Professor Seatel. I've only sit in meetings with Professor Seatel where she really start unpacking all the stuff for government to understand. And it's actually nice to get the sort of 101 of modeling talk as well. Thank you for that. I'm just going to share my screen. Okay. So I was asked to, but basically, as Professor Burton also mentioned, yes, we are looking into, we are receptive for research, and Professor Seatel on, and government immediately started to look at what are we going to do and how are we going to do it. So one of the things that I've learned from the whole COVID response is actually how well people can work immediately, can bring their expertise together and start working together. Groups that are normally in competition with one another, but how they could sort of bring it together and say, fine, we've got a problem, what are we doing about it? So what we've done is immediately in March 2020, before we even had the first case, when we see that it was inevitable, we're not going to escape it, between Department of Science and Innovation and the Medical Research Council, we said, what can we be doing? What are the next steps that needs to happen in South Africa? What are the areas that we should be putting research funding into? Luckily, we had the Strategic Health Innovation Partnership already situated at the Medical Research Council, and we could draw in all the processes that has been proven over the last 7 years to go on. So the first 3 projects we were looking at was specifically around surveillance, because we need to know what's going on, community engagement, and epidemiology. And based on the fact that we were able to repurpose funding, and then additional funding was made available in the next financial year. So for the basic health innovation component of the research, we have provided just below 70 million rand in the last financial year to drive the research agenda as such, and I will come back on some of them, sir. But also we have to ensure that we still adhere to the rigor of responsibility around research funding. So we are using then also a selection committee comprising of a number of scientists as well as administrators, then to see which projects should be funded, and also to a certain extent which projects should be terminated. Currently there's 21 projects that is being funded. Most of them are sort of ongoing projects, and we are all reaping the benefits of those specific ones. So the major things are the surveillance projects, to understand what is happening with SARS in the hospitals. That is informing the Department of Health around the deaths, around the comorbidities, and that is one of the major areas of information that is fed back to the Department of Health. Then we're looking at the genomic investigations around it, especially how it will affect HIV affected and non-infected people in South Africa, because we cannot suddenly say, but we do not have other important diseases as well, and how it will be affected by that. And then looking at the phylogenetic component of it, and I will talk a little bit more about it. And from previous discussions, I assume somebody has been talking already about the detection of SARS-CoV-2 in wastewater. And that is actually a very important project. It's been rolled out to more and more municipalities, where they can actually they were able to pick up the second wave almost 2 weeks before it started to become more apparent at the hospitals as such. So it's a very important tool that can predict where are the hotspots, and then so you can divert your healthcare workers to that specific thing area. So important is also that through this all, we need to have a biobank of sera that we can understand what are the biomarkers, how does the disease progress, and so we've made that kind of infrastructure available as well. One of the major areas we were looking at diagnostics and to what extent we can actually do our own diagnostics. This is taking quite a time, but in the end, we are able now to produce some of the diagnostics, but it also built the capacity as such. And very important is that we are also looking at your tools that we can use for serological testing and to determine whether somebody had the disease or not. That is mostly used then for surveillance purposes such. We spoke about that. On the initial projects that we were involved with on the vaccine side was specifically we're still supporting a plant-based manufacturing of antibodies for COVID-19. And there's a number of vaccines that's actually based on that technology, but they also use the technology then to make the antibodies that is used for in the diagnostic sphere as such. And importantly, we funded the HIV component and the community engagement component of the Oxford Zeneca vaccine. And that is where Professor Marty was involved with as such. We also looked at you've got all these claims about different drugs, whether it's working, whether it's hydroxychloroquine, and the latest was ivermectin. And there's a lot of people making claims, but we actually need to really understand, does it make a difference, yes or no? So there's a lot of funding that's going into those specific clinical trials where we tested to say, yes, this this specific drug works for the disease or it does not work. Up to this point, we haven't found that molecular drug as such yet. So then we're also looking at I spoke about that. Then the medicinal plants, assume they already spoke about the work that's going on around that and the clinical trials that's going to go ongoing as such. But not only on the biomedical side were we involved, we were also looking at Earth observation. How do we use your satellite systems that we've got that we can understand where are the hotspots, but also which areas to look at human settlement density, and also then assist for planning purposes for the Department of Health as such. And then on the clean technologies, energy technologies, the solar power packs that's being rolled out to clinics. It's been rolled out to the South African police services in order to assist them to provide the necessary services within the COVID epidemic as such. Now, the main one that I want to talk about is right from the beginning, one of the first projects, it's actually, it's the second project that we funded, was specifically around understanding the phylogenetics. And we were looking at what happened in KwaZulu-Natal. And by building on the capacity that was built through other investments in the bioeconomy, such as CRISP, where we're looking at building the genomic surveillance ability in South Africa, but it was used for TB and for HIV, but it could immediately be swung over then to COVID. We also start then that group combined with the clinical expertise at KwaZulu-Natal Medical School, combined with the African Health Research Institute, all situated in the same building. And I think that is one of the major important components. The people were close by, they could start working together. They then created this surveillance of what happened in the St. Augustine Hospital But at the same time, doing that, they also started to look at what's the guidelines that we will need to do for community testing. And so in April, they then developed the tools that the community healthcare workers are still using up to now to understand what is going on as well. And what is important is that while we are encouraging the reaction to or the assistance with the COVID, they are still academics, and we have to make sure that the academic component of those people are still being honored as well. So a number of very important articles is also coming out of all of this research that's supported. So following that first St. Augustine outbreak surveillance, then they created what we call the Network for Genomic Surveillance in South Africa, and they then not only are within KwaZulu-Natal, but it's actually spread across the country, where they then work with the National Health Laboratory Services to understand what is happening with the virus. When will it mutate? What viruses are actually floating around on the moment? And they have done more than 300, they've done more than 3,000 genomes, and we're hoping to hit 10,000 in the not far future as such. But based on that information, they were then able to detect the emergence of the 501YV2 variant, first in Port Elizabeth, then it moved to Cape Town. They sort of, as a joke, said to the people in Cape Town, see if you don't find this one as well. And yes, they did find it. And then they found it in KwaZulu-Natal and then Gauteng. And this is where they can actually now map out how this virus then spread through the country, to the extent that we now have more than 90% of all cases in South Africa is actually from the 501YV2 variant as such. And this is quite important. What happened then as a result of that, the researchers then said, we've got this information now, what now? First of all, does this variant have a different impact on the disease? Is it more contagious? Is it more deadly? So they have to start looking into that as well. But one of the major things is now everybody's talking about these vaccines. We are investing in all these clinical trials. What will happen to the vaccines? The researchers were then able to actually grow the virus in the laboratories. It was not easy to do that. It took them really more than 3 weeks to actually just grow the virus in the laboratories. But they will also then, through the collaboration with the NICT, created pseudovirus assays that they could use then to test. And based on that, they then started to look at sera from people that received the vaccines in the clinical trials, to see to what extent the vaccine had an effect on the virus. And based on that information, combined with the information that was made available by Professor Mardi, then the decision was taken that South Africa will not be able to use the AstraZeneca vaccine, with a lot of unhappiness by a lot of people. But at the same time, because the researchers were then involved already and they doing this, the researchers could come to the rescue of South Africa, to put it like that. And the group that was involved with the Johnson & Johnson vaccine were then able to say, we've got the clinical trial sites, we've got the links, and we can find you the vaccines. And based on that is why we are able now to actually start rolling out the Johnson & Johnson vaccine as such. So what is very important is the researchers has been able to work together. And because we could take away the burden of finding money for them, they don't need to worry about money, then the whole, they could do it so much faster as such. So that is just sort of a network from the genomic surveillance. They also now start looking at what is the effect of the virus, to what extent do we have immunity, built up immunity or not. And so that is very interesting work that they are doing now as well. So I spoke to about that, and yeah, so we are building further the network of genomic surveillance, because that's definitely been proven to be a very important tool within um, the management of a pandemic as such. When COVID is no longer such a threat, those same tools will then be utilized for HIV, for TB, for your non-communicable diseases as well, because we've now established the networks, and we will ensure then that they actually carry on as such. But what we've done is we've actually established that South Africa is a major player in this area. And what is very interesting is when they discovered the 501YV2 variant, the researchers at KwaZulu-Natal actually contacted their counterparts in the UK and mentioned it to them, and then the UK only started to look to see if they found it. So we were the first ones to alert that there's something seriously going on, and then that actually triggered the whole international reaction. So it's something that we as South Africa should be very proud of what is happening as such. So that's just sort of, we're looking at the science component as well when they start publishing in your major scientific journals as well, and it's being accepted and applauded across the world as such. Now, not only on the biomedical side, the Human Sciences Research Council has also been looking at the attitudes, the perceptions of people around the COVID. How do they experience this? How does it influence them? And that information is then fed back to government so that we can know what is actually happening on. So there's a new wave of the healthcare workers survey that's coming out in this month, where they start looking at how does the health workers cope with it, and the whole social component around it as well. Then there's the community-based survey of the public study, where people will be encouraged to provide their perspectives online, but also it is first based on community surveys that's being done. A major component of this public study is then to look specifically at around perceptions around vaccines, and whether people will use it or not use it, or the fears around that as such. And then at the same time, we're also looking at the Presidential Employment Initiative and utilizing it then to actually train field workers then for these studies as such. Now, the CSIR is one of the major entities of Department of Science and Innovation, and they've been right from the beginning, they've been very much involved with this. And they first started with the Information and Decision Support Center, then the testing laboratories that's being provided, the ventilator project, and now the electronic vaccination data system is partly developed by the CSIR as well. These are just a list of all the projects that the CSIR are involved with. So there's a lot of things that is happening in the research environment that you don't know about it, but the information is actually, you'll just see things happening. It's informing the reaction from government, and it is sort of providing us then at the same time to what extent we can then grow small businesses, to what extent we can actually assist small businesses as well. So there's a lot on the research side happening. We're not very good at sort of hanging up our banners to shout what we are doing, but there's quite a lot that we are doing, and I think we should really thank the researchers for the effort that they are putting into finding solutions for us. Thank you.